Good morning. I'm just about at work. I had to make a stop, feeling a little bit depleted, but it's the end of the week, and you will see that this today is sponsored by the letters A, U, and S, or C, X, and R. So AUS is an abbreviation for abdominal ultrasound, and CXR, did I say it backwards before? A little dyslexic, is for chest x-rays. So today we have a ton of imaging patients. We have our internist joining us today to do some ultrasounds behind the scenes. So hopefully we're gonna have a lot of remission checks and a lot of good news. And it is TGIT, and then headed into the weekend for me. So here we go. Got Penelope in the back. You there, girl? Good girl. I don't know if you can see her, but she's back there. She weighs 35 pounds. She's getting huge. She's just over 5 months, and I'll get her on screen later. All right, let's do it. So today I'm going to tell you about two amazing kitty of ours. I'm going to tell you about Miko and then JoJo. So Miko was diagnosed with high-grade nasal lymphoma in October of 2012. Do you believe that? It's amazing. And she had cyberknife radiation at my old facility, right, Miko? I love her. And then we did chemotherapy, and she's been in remission ever since. Yes, I'm a little superstitious. Just last month, we saw some big lymph nodes in her belly. Mildly big, not too much to get worried, but we're just gonna recheck that. Last month, we did a CT scan that had normal nose and chest, and everything else in her abdomen except for her lymph nodes were normal. So pretty amazing kitty. Go, Miko, go. Okay, in case you weren't impressed enough with Miko, let me tell you about JoJo. JoJo was diagnosed with lymphoma in his chest lymph node in, wait for it, 2010. It's 2017. That was July of 2010. So this is over 7 years and 2 months. Pretty freaking cool. So these are JoJo's original x-rays when he first came into the hospital in 2010. The doctor who saw him for difficulty breathing, and when we took x-rays, there was an easy explanation. So when we look at x-rays, this is towards the head, and then JoJo's tail and abdomen are over here. And so this is his back, and this is his belly side. And so we're looking at the chest cavity here. Normally it should be mostly filled with lungs, and then the heart is in the middle, but his lungs are being squished over here because there was a big lymph node called a mediastinal lymph node, and then fluid around his lungs that was compressing, and that was his form of lymphoma, which is called mediastinal lymphoma. If you look at this other view over here with him laying on his back, again, this entire area should be filled with air in his lungs, but it's being compressed, and then there's all this fluid around his lungs, and then the big lymph node, the mediastinal lymph node, is in this part of the chest here. So again, these were his x-rays in 2010. We tapped off the fluid, so we removed it and started on chemo like we talked about, and now I'm going to show you his x-rays from today. So here you can see JoJo's x-rays from today. They look great, right? So again, his head is this way, and his tail is that way, and his back is there. And so what you're seeing is normal lungs filling the entire chest cavity. This gray area here is his heart. And remember, air is black, bone is white, everything else is a shade of gray. And this is where that big lymph node was sitting. And then remember, it was completely squishing the lungs and compressing them. Here's the other view with him laying on his back, and again, you can see nice extension. The lungs are completely filling the chest cavity. We have the heart in the middle, and on this view, the mediastinal mass up in the front of the chest would have been there. So again, these are great x-rays for JoJo, and help confirm that he's still in remission 7 years later. He did relapse in 2013. He had to have half of his jaw cut off because he had a bone infection that was completely destroying his jaw. And the surgeon told us that 50% of the cats will never eat again. And he ate the next day and gained a lot of weight back. And we went through a second 6-month University of Wisconsin chemotherapy protocol, and he's been in remission. Yep, knocking on wood again, ever since. So I had told these owners when he was first diagnosed that most of the cats with his type of chest lymphoma with that lymph node in the chest and fluid around the lungs don't usually make it through the first 6-month protocol. So I've been very wrong for JoJo, and JoJo continues to prove us all wrong, which is super fantastic. Comes in usually 2 to 3 times a year for chest x-rays, an ultrasound to make sure his lymphoma is not relapsing, and some blood work. Did lose a little bit of weight, so we're going to be doing our test, and hopefully he and Miko will be in remission. And again, today is all about our kitty survivors with lymphoma. All right, JoJo, it's a very good day. You wanna know why? The 7 years and you're still in remission. Perfect ultrasound, good chest x-rays. Just gonna wait for your blood work, okay, buddy?
Thank you so much, Dr. Sue. You have done outstanding work, and you don't go the extra mile, you go the extra millimeter to do the right thing.
He's cancer-free.
Amazing.
Thank you.
This cute little picture is one that I use in some of my lectures when I talk about JoJo. At this point, he had already had his jaw surgery and was over 4 years out from his lymphoma diagnosis. So, you know, at this point, who would have guessed that he would live 7 years? Pretty amazing. We love our little statistics buster. Well, we made it through the day. It was a busy, a little bit stressful day, but I'm super, super excited that pretty much nobody was crazy out of remission. There were a few questionable things where I'm going to have some patients come back in a month to recheck some imaging, specifically ultrasounds and x-rays. But JoJo, 7 years, 2 months out from his original diagnosis of lymphoma with 1 relapse. His family's moving to Florida, so we wish them the best. Hopefully their new place will be okay through Hurricane Irma. And Miko, who's 5 years out from her nasal lymphoma, that lymph node in her belly was still a little big, so we're going to see her back and recheck that. We're not going to go out the 5 or 6 months that we usually go with her. But overall, it was a great day. Just getting home, got to run to the kids, my son's open house at school, but it was a good day. Penelope kept us entertained with her frisbee antics. And her playing with her shadow in the bottom of her cage. And I'm gonna go inside and see my Matilda, who's scheduled for surgery next week. So pretty good day, and TGIT. I know, I like it when it gets to the weekend. Enjoy yours. See you soon.